Welcome to another episode of Real Talk with Dr. David Samadi. Today's episode is very special because not only we have a great guest, someone who is extremely knowledgeable about the field of plastic surgery, but I consider him my very good friend. I didn't really know this doctor about 2 years ago, but over time, not only I got to know him personally, but he has saved many, many lives of his friends and colleagues who had prostate cancer. And that's how I got to know his work. And I have to tell you, you're going to be very impressed with the kind of plastic surgery that he does. And we want to dig deep into the work of the plastic surgery and the world of plastic surgery in Dominican Republic. This particular special guest is Dr. Manuel Peralta. Dr. Peralta, welcome to the show.
Thank you, doctor. Welcome here with everybody that you have in the population. Real Talk is a good way to bring information for the patients.
It's a pleasure to have you as part of our show and the podcast. We will talk about real world and how you got to this point, and also some of the work that you do in plastic surgery. Let me just tell you that Dr. Peralta, besides being my friend, he is a very well-known plastic surgeon, trained in Dominican Republic.
Yes.
Very proud of that. But also he has like extra expertise and fellowship in Brazil.
Yes.
And everybody knows about the Brazilian butt and the Brazilian breast implants and everything else that we'll talk about. That's the sexy and hot part of this topic.
We have many things in Brazilian school because you know about the bodies, you know about the silhouette and the anatomic patients that prefer look younger. And it's good for the training in plastic surgery. Brazil is the second, not the first, but the second place to learn plastic surgery.
That's great, but I also want to tell the public that you're not just another plastic surgeon. I have noticed that over the couple of years that I know you, and I've seen a lot of your work, that you're basically combining medicine, science, and most important, I think the key to success of a lot of surgeons is to be compassionate about what you do and to put your heart into it. Of course, when it comes to plastic surgery, details, just like the work that I do and the robotic surgery that I do, is very, very similar work because it's all about details of the nerves and the flaps.
Yes.
and everything else. So I want to welcome you to the show, and I wanted to tell you, the first thing I want to know is, how did you get into this field? Because when I want to grow up, I want to be a plastic surgeon. This is work.
You are a big guy and you complete all the person that you come to the life. For my occasion, you treat my father and treat a lot of my friends. And I think that when you think in the health of the other people, for example, when come a couple with my consultation, I talk with the women about the surgery, but the husband is here together 50 years. And when I finish and I close the surgery, I finish the abdominoplasty, I finish the facial surgery, I ask him, and you are taking care about your health? And many husbands told me, no, doctor, and go to the Samadi office.
Always ask
go
them
there.
about the PSA. I cannot tell you how many times, Manuel, we see patients that you ask them, what is your PSA? And one of the big problems we have in Dominican Republic, as you have seen, and
the prevention.
Noticed, oh my God. I mean, the fact that we have a 51-year-old in the office that we saw last week. The PSA is not very high, it's only 13. But the biopsy is very aggressive. And unfortunately, the cancer is spread everywhere in the abdomen. Really, really sad story. Just today alone, I saw another patient, and this is the first time that he's come to the office, and his PSA is really high. They did a biopsy, and again, 57-year-old, the cancer is spread. What really, really upset me is before he left, he said, doctor, and he stared in my eyes, and he said, doctor, please help me.
Yes.
And it's very difficult because at this point, there's no surgery, there's no radiation. So we want to prevent this. And I know you've done your share as a plastic surgeon, saved many lives of people with prostate cancer.
Yes, but let me tell you in my point of view, For example, the women's have every year go to the gynecologist, every year go to the mammography, but the men don't do anything, only work, enjoy the life, and don't take care, don't pay attention for the health. And it's a problem that we need to take a lot of attention, because everybody have factors that increase the possibility that you have a cancer in the prostate. And when you have some friend, when you have some familiar people, relations with this problem, it's difficult to take care of them. The prevention is the first one that you need to do for the people, save the life.
Good. Let's not talk about prostate cancer because we can talk forever. I want to talk about more exciting stuff, which is the plastic surgery.
You prefer talk the plastic surgery, and I prefer talk to
exactly.
The urologist.
When I look at some of the people in the audience, we have all the women out there that want to know about your surgery. Number one, how did you get into plastic surgery? Everybody has a story of how they became the surgeon that they became. Why plastic surgery, and how did you get into it?
I got to the plastic surgery when I finished my college, my university. When I finish, I go to the surgery in the first time, and I will do surgery, abdominal surgery. Is my approach to the surgery. When I finish, I pass 1 year in the military hospital, and I worked with 2 plastic surgeons there, and I meet all the work about the reconstruction, about the people that have burns, the people that have lips, cleft lips in the child, and come with this breast surgery, augmentation, liposuction, abdominoplasty, and another aesthetic word that you have. You have 2 words in the plastic surgery: reconstruction and aesthetic surgery. And if you have good evaluation, you can mix both of them and work with everybody. For example, the last Saturday, I was in my house and someone called me. You are Dr. Manuel? Yes. I have a problem. My wife have a trauma in my hand, in the hand. And I go to the clinic. After this, with the points in the finger, she told me, I will be back here for the breast. Everybody think about the good news and bad news. You finish with the better body.
With the good news.
Yeah, and the good news.
And the good news is to look more beautiful and do more plastic surgery. Tell me, what is the most common procedure that you do, and what is the most favorite surgery that you do?
The surgery that I prefer to do is the facial surgery, because my training with my mentor, Professor Ronaldo Pontes in Brazil, he was an icon of the facial plastic surgery. But right now, in the moment in Dominican Republic, the people prefer body contour, breast lift, or another points, a little bit surgery in the face, but not big surgeries. I think that abdominoplasty and liposuction is the most common surgery, but I prefer facial surgeries. It's not common, but I enjoy it.
Is there a difference between the Dominican plastic surgery and other places? Like, for example, people go sometimes to Colombia, they go to Brazil, they go to America, and I see, in Dominican Republic, the waists are narrow and they prefer a little bigger.
No, I will explain you what's happened. We have 2 points of born a plastic surgery from Dominican Republic, made in Dominican Republic, in the Hospital Salvador Begotier, and the people come from outside, from Venezuela, from Brazil.
Which is the medical tourism that your center, CICILIP, attracts a lot of patients from all over the world. Even Americans, I heard that they come.
We receive patients from Canada, we receive patients from United States, from Europe, we receive many, and the islands of near Puerto Rico, Jamaica, we receive many people because the clinic have FDA-approved control for all security on health for the patient. This is the most important goal that we have. We take care of the patient before they take care of the beauty.
Follow the standard of care the same way, exact way as in America.
Yes, it's the standard, gold standard to take care of the patient.
So how is the Dominican surgery when it comes to breast and the butt area? How is it different than others?
You don't have any difference. The patient told you what she wants. Doctor, I need a big boot. I will do. Maybe I don't put in my page because I prefer the more elegance, more contour in the body. But if the patient told me I don't want any fat in my boots, I don't put
So
because you will finally do what the patient wants. A difference of your specialty, you will take the last word.
Exactly.
In my specialty, the last word is my patient chose because the patient is healthy.
Okay.
You don't need to live without surgery or with surgery. The life continue. But you coming because you can feel better if you see something that you agree in the mirror.
Manuel, sometimes these patients are out of control.
Yes.
You've seen them.
Yes.
Now, I don't have any experience with particular plastic surgery, but I've seen some of the shows in America. One of them is, like, the famous one is like the botch surgery, where two plastic surgery describe these women that almost become mental or psychologically.
Yes.
They have, I don't know, 36 double D, and now they want like triple D, and this thing, this breast implant is so big.
This have a name, body dysmorphic syndrome.
Okay,
When
so
the patient see everything different than reality. For example, is a big boots, for example, 500, 600 cc in each breast is too high. For example, another patient that want injectables in the face and put the lips very big and don't move and keep a mummy face is the name. And when we have this patient in front of me, I try to go to this psychologist evaluation and try to not continue with this problem through me.
So there are patients that you have to recognize this issue and not do what they want, because otherwise this continues to...
Yes. Many times you entered in the surgery room, many probabilities you have to complication. If you go one time in 10 years, is less probably that you have a complication if you enter 5 times. It's difficult to know, but I try that the patient take conscious about the surgery is not a game. When you have a surgery, you need to pass to cardiologists, evaluation of pneumologists. You need to do everything that you need to recover your body. It's a crash. When you take fall down from the second floor, it's a surgery of appendicitis. If you fall down of the third floors, you have a surgery prostate.
It can become more complicated.
If you elevated the level and fall down, is the more surgery in your body, and in one fall, you can have a problem with your health.
What do you think the long-term issues with these Botox on the faces are? Because it's become very common for women all over the world to inject the toxins. I guess it's a botulinum toxin. What do you think, like, over the years, it's going to do with their muscles and the facial expressions over time, giving this Botox all the time?
The problem is, Samadi, right now, in the commercial area, the people need to look younger.
Yes.
Because you have 50, I have 44, but you look younger than me. You look younger than me.
I don't feel younger.
You don't feel younger. The articulation don't feel that. Yeah. And the people need to be and feel better because the competition in the area is very difficult. When you look younger, you have many probabilities that the people take of you for work, not in the medicine, for another areas, for merchandise, for working in legal, and other areas. And many people, men and women, have used the Botox and the fillers for continue this fresh face.
Is there a long-term issue with that? What do you think?
It's 1 year, for example. If you do it, the Botox, I will use the best Botox in the market, and it will be repeated one a year. It's not common.
You don't want to do it very common.
I think that Botox is the most common procedure.
So I saw like another procedure that you were doing is you were doing a lot of liposuction, and then you guys take the actual fat and inject in the buttock to give it a more contour.
Yes, when I have a liposuction patient and she need to contour the buttocks area, I take this fat is a stem cell. We have a stem cell in the fat cell. We will take this and contour all the area of the buttocks, but we can do in the face too. We can put the fat. We can put the fat in the pectoral area, for example, in the men's. And in another area that you can work it is in the six-pack. You can put the fat in the six-pack to mark this area after a liposuction.
This is in men.
In the men.
So you not only work on women, but also a lot of men come to you guys.
Yes. The body contour is equal for the men and women. If you have a fat deposit, you can retire.
So you're saying I can come and you will take some of this belly fat and you actually can make it into a six-pack. You hear that, men out there?
Yes. The body contour is the most common surgery
Is it
right
a
now.
complicated surgery?
No, it's not a complicated. Complicated is the health of the patient. If the patient have a good health, it's a good surgery. If the patient have any problem of health, you have complication in the surgery.
So how long is the surgery, and then is this a long recovery for men out there who want to do that? Because everybody would love to have a six-pack.
But let me tell you, the man is more difficult to recover than the women.
Why is that?
I don't know.
They don't listen.
I don't know.
But do we have to wear this?
Everything that you do in the man have a pain. Doctor, I can't believe it's a lot of pain in my body.
Is it really a lot of pain or no?
No.
And what do you have to do? You have to wear these corsets, or what do you call them? The abdominal binders?
I use the corsets, the garment, the first stage.
How long do we have to wear that?
Maybe 3 weeks, the first stage, and the second stage and third stage I will do for the second month and the third month.
So basically
and after
3
this,
months.
90 days. And after this, you have the adherence of the muscle and the skin. When you use the garment, you promote the cicatrization of this area in the correct position. It's important to use.
Does they have to be on a special diet to keep that six-pack moving forward, or?
I prefer the high protein and vitamin because it's good, because all that you broken in your body, you need to correct. Collagen need to go there, and collagen is a protein. Protein, vitamin C, and zinc will correct everything here, and you recover very comfortable.
I want to ask you a question that probably, I don't know how many people have asked you this, but you're dealing with women all the time, and you have to make them feel comfortable. So they come to you, you've never met them. Obviously, because of your reputation, they get naked, and they tell you, like, I want this bigger, and this one, more smaller, and the butt bigger. What goes on in the consultation? Are there times that you tell them, like, in my opinion, you should not do this, you should do that? Or is it computerized where you can show them tell us, like, what goes on in the whole chemistry of you and the patient and the actual art of surgery?
The first approach with the patient is the consultation. I wrote everything that the history of the patient in the health important for me. After this, in the last time, I will ask about what do you want to do, or what can I do for you right now. For example, I have a patient with the cardiac problem, cardiac arrest, or embolism in the past history. I don't ask, what do you want to do? What can I do without harming you is the most important. When I pass to the check room, obviously, I pass with my assistant, always. I have an assistant together with the patient. If the husband is here, I come with the husband because it's a project between two peoples. The body is from the women, but the final consumer is the husband.
Correct.
I need to talk with both. And it's important to guide the patient, because when the social medias you see many bodies, but these people pass many time in the gym. These people have another history. When you have a mother of 3 childs, 180 pounds, one husband, and many things in your life, you can compare with Kim Kardashian.
I swear I was just about to talk about Jennifer Lopez and Kim Kardashian because everybody have seen them
Yes.
on the social media, and everybody wants to have Kim Kardashian butt, and they want to have Jennifer Lopez breast. So that makes your life much, much more difficult.
You can do that, but remember, Jennifer Lopez have many, many surgeries in your body and rest time. When you have a patient that work in Walmart, for example, is manager in Walmart, she have only 3 weeks to make a surgery. It's not the same.
It's much more difficult.
It's more difficult, but we can do it. Don't worry, we can do it.
Listen, there are a lot of American doctors that when they hear a patient is about to go to Dominican Republic, and I've had even my share of patients from America that came here for whatever reason, insurance issues, or they just, wanted to be here and they recover better, etc. The American doctors are saying like no, don't go to Dominican Republic. You may have an issue, etc. Then you're alone and nobody's going to take care. There's a scare tactic. Tell me why, and is it safe, and what situations you have had in the past, if you've had any, where American patients, why should they come here to begin with, number one? Is it the price? Is it like the cost? Is it the outcome? Is it the skills? And why do we have so much medical tourism in plastic surgery in Dominican Republic?
The medical tourism, the big deal is the skill of the surgeon. Every place do you have good people and bad people. In the United States, in Canada, in Europe, and Dominican Republic. You have many people that don't make the preparation and go to make plastic surgery. And it's the money, the first deal, that this doctor that don't have the preparation go to this area. In different to United States, that if you have a license that USMLE pass and you don't have any evaluation or preparation, the board certified, you can do the liposuction there. You know that?
Yes.
Here in Dominican Republic, you can do it.
Which is unfortunate because there's so much overlap in U.S. The ears, nose, and throat surgeons can do some plastic surgery. The urologists can do some plastic surgery.
Yes.
Almost so many different fields of surgery are doing Botox
But you don't see urologists doing
here,
gynecologists.
Correct.
You don't see plastic surgeon doing urology surgery. But it's the money, the big deal that the people take the look in this area. But in Dominican Republic, the medical tourism is the contour of 3 points: the skill of the surgeon, hospitality, and price. When you have a surgery that have $100 in United States, maybe here with the flight, hospitality, and the surgery, you will spend maybe $7.
Well, I have visited your center, Cecilia. It's a beautiful place. Many, many different plastic surgeons work together, very high volume, and I call it the center of excellence for plastic surgery. So I have seen it. I've been in the operating room just to visit and see what you guys do. So I'm very proud of the work that you're doing and the other plastic surgeons. I've seen on your social media before and after pictures, which are very, very effective. And just continue to do a great job and take care of the patients the way you have been, and your reputation speaks for itself. For the last minute or so, maybe you can speak directly in the camera and tell the audience exactly what type of patients you would like to see more and what you can do for them and how you can make them more beautiful.
Thank you for this word, because when you work in every day, you don't look the people that are around of you looking your work. It's like you.
People around you notice it better than yourself because you're busy.
Yes. And I recommend my plastic surgeon exercise is too much. I think that the people talk about us. when you have a touch of life, when you save your life, and I change the life of my patients. This is the best card of presentation. In Cecilib, we have many doctors that have good preparation, good skill, and we will take care about your health. If your health is okay, your beauty, it will be in my hands, and I take care too.
I appreciate that. And I think, Manuel, it's a great pleasure to have you in our podcast. I think what's important is with the advent of Ozempic and Wegovy and all these like medications that are coming up, you know, obesity is going down. People are losing tremendous amount of weight. And I see these big flap of abdominal fat that will continue to come for a long time. So all this, abdominal surgeries that you're doing is going to really help them a lot and make them look good and feel good.
I receive many patients with Ozempic use, and you receive this patient with low weight. The problem is the mind.
Correct.
If the patient thin, fat, you will be fat again.
I think it's helping a lot of people, and I think it has really reduced the number of bariatric surgery, certainly in America and also in Dominican Republic. I want to thank you for being our guest. Continue to do a beautiful, beautiful job. Make all the women look pretty as you always do, and maybe I should come to you and get one of these body contour. I think that's very encouraging. So I want to thank you again, and I think that if you are if you need like some extra work, I'm sure you're beautiful, but if you need a little liposuction here and there, or you need like to take care of some of those wrinkles, or you need to just like really get those contour going, beautiful abdominal shape and the butt area, call Dr. Manuel Peralta, my friend, who is like an excellent plastic surgeon in Cecilib Center. And it's a pleasure to be with you, and keep up the good work. Thank you very much.